Welcome back to another episode of Lawyer Up. I'm Joshua Roberts, attorney at law, and today we're going to be talking about a hot topic. We're going to be talking about the coronavirus. We're going to be talking about emergency powers, executive orders, quarantines, shelter-in-place orders. What does it all mean? And who is an essential business or an essential employee? We're going to talk about all those things today in this episode. Do me a favor, if you learned something today, hit that like button. If you want to learn more, subscribe. And if you think there's something of value, share it on social media. We're ready for Lawyer Up. So the first thing we're going to talk about is what is an emergency power? Who has the authority to use it and where did it come from? An emergency power is the power that a chief executive officer has to deal with a particular emergency situation. At the federal level, of course, our chief executive officer is the President of the United States, who right now is Donald Trump. At the state level, your governor is going to be your chief executive officer. At the county level, you're going to have, depending upon the state, either a county commissioner, which is usually a panel. Some states call them judges, which is a little bit confusing because they're not the traditional wear a robe type of a judge. And then going down to the city level, usually the chief executive officer will be the mayor, and he may or may not, or she, exercise their power in conjunction with a city council. Sometimes it's a combination of a mayor and a city council. But these are the entities that have the executive power or emergency powers to act in a situation where we have an emergency situation. One question that has come up is what gives these individuals the legal authority to act? And a lot of people, and I've seen this on national news, say that it is the Constitution of the United States that gives the President of the United States that power to act. And that's partially true and partially not. The reason I bring that up is I would challenge you to take a look at the Constitution and try to find in there where it gives the president the express power to act in emergency situations. You won't find it because it's not in there. However, the Supreme Court of the United States has stated in several opinions that this emergency power is implied or inferred in the Constitution, and so the Supreme Court has held that the President of the United States has the power to act unilaterally in a situation of an emergency. And I think it makes a lot of sense because in certain situations where you've got a wartime issue, you have a natural disaster, or in this particular case, we're dealing with the coronavirus pandemic, it makes sense to have somebody who has the authority to step in and basically take the bull by the horns and do what needs to be done. Sometimes you don't have time to let Congress bat it back and forth and then maybe be challenged at the Supreme Court. You need an executor that can take action immediately, and that's what we have with the emergency powers that are inferred by the Constitution. At the state level, your chief executive officer is going to be your governor, and his or her power to act is going to be expressly stated in most state constitutions. In those states where it's not expressly stated, it's also been inferred by the Supreme Court of the state that that chief executive officer has power to act. When you move down to the county level, it's usually, we talked about this before, the county commission, who's authorized by the state to act, and or city charters authorize the mayor to enter into these emergency executive orders. The next question or issue that we have to have is an emergency. What constitutes an emergency authorizing these executive officers to act? And traditionally, it's going to be some type of a war situation. It's going to be some type of a natural disaster. 9/11 is a good example. Hurricane Katrina is a good example. But right now we're dealing with quite a different obstacle. It is not an epidemic, which is a problem that may affect part of a state or part of a population, but we're dealing with a pandemic. And a pandemic is something that will affect an entire country and or, like in this case, we've got an issue that's affecting the entire globe. And that is the COVID-19 or the coronavirus situation we're currently experiencing here in the United States. So the question is, does the coronavirus constitute an emergency? Well, I would say that it does. And I'm going to give you some statistics on this topic. They are current as of today, which is March 25th of 2020. However, this is such a fastly moving topic that as soon as I utter the phrases, they're going to be obsolete because the numbers are changing so rapidly. But here's just a little bit of information about the coronavirus. In the world, there are approximately 400,000 confirmed cases. There have been over 17,000 deaths. There are over 100,000 people that have recovered. If we look at the active cases around the globe, there's 270,000, and these are all approximate numbers, cases. 96% of those cases are considered mild. 4% of those cases globally have individuals in critical condition. If we look solely at the United States, right now we have about 50,000 cases, and we've had about over 600 deaths here in the United States. Of those cases, most are active. Almost all of the cases are active. Those active cases in the United States have 2.5% of them in critical condition, and the fatality rate in the United States is sitting at about 1%. I've had other people and seen on social media comments that, well, that fatality rate is not significant. But, I would beg to differ, and it brings to mind the poison pill analogy, where you've got a bottle full of identical pills, and 99% of them will cure your headache instantly, but one of them will kill you. Do you take the pill? Well, most reasonable people would not take the pill, because a 1% chance of death is unacceptable to most reasonable adults. So having a situation, a pandemic, a COVID-19 virus with a 1% mortality rate, is that an emergency situation? I would say that it is. So from there, we take the next step and we look at what can a chief executive officer do in connection with an emergency situation. And really, they're only limited by their imagination. They can take a lot of different actions on a temporary basis to try to alleviate the emergency at hand. In this particular case, let's take a look at what the President of the United States and local leaders have done as the COVID-19 pandemic has progressed. If you'll recall, the first thing that was done was that they shut down mass gatherings, and this includes the sports venues, schools, concerts, and mass transits. I can remember sitting at the house watching the NBA game and them announcing that this would be the last game, that the NBA had canceled its season. And this was early on, and it was shocking. It was surreal to watch the game with my son and realize that this virus was something that was going to infiltrate the United States and be a significant problem. The next step, as you may recall, is when there was executive orders to reduce the gathering sizes to no more than 250 people. That took care of the large gatherings, but people could still have small churches, could get together and do those types of things. That was in place for a very short period of time when it was cut down to 50 people or less for gatherings, and then ultimately to where we are today, where there are actual ordinances that say no more than 10 people can gather together due to the infection rate of the COVID-19 virus. Also, there have been the institution of social distancing. We've all heard that. That's a 6-foot radius from person to person to hopefully stay outside of an area where you can be infected by the coronavirus. The government has also basically outlawed or shut down high-frequency contact areas. These would be like restaurants, lobbies, movie theaters, bars, gyms, those types of things where the same people would be interacting with the same equipment or chairs or those types of things. And the government's also, as part of this executive order, shut down high vulnerability areas. They are prohibiting who can go into hospitals, who can go into nursing homes, who can go into long-term care facilities, and they're doing that to protect the vulnerable people that are inside those facilities. Most recently, and this has been going on in my state, we are receiving shelter-in-place orders, where basically we're being told to stay home unless, and there's a wide variety of reasons why you may be able to go out of your house. It's interesting, the shelter-in-place is a concept that have come out of mass shooting situations. It's a concept that when there is a shooting going on, you should not try to run out of the building, not try to escape, but you should shelter in the place where you're located and try to hide. That term has been borrowed and applied now in this type of virus situation. It's also being referred to as a stay-at-home order, shelter-in-place order. Those are two of basically the same things, the same types of orders. Now let's talk about some of these terms that have been thrown around. Quarantine. Quarantine can refer to two different things. It can refer to a period of time or it can also refer to a place of isolation where one is who is suspected to have come in contact with a virus or a contagion or an infectious disease will be basically in isolation. In the United States, we've been talking about quarantines for people for 14 days. If you think you have traveled to an area where there is the possibility where you have come in contact with somebody with COVID-19, you're being asked to, but at this point not mandated, to self-quarantine or basically put yourself in isolation away from other people for 14 days to make sure that you don't have any exposure to the virus. We're also hearing terms like self-isolation, and that's where you basically pull yourself away from the situation, isolate yourself in your own home. There's actual isolation, which we have in hospitals. We've seen this overseas where they're mixing people with COVID-19 and other patients in the same hospital has had basically detrimental effects to other patients. The situations where they have been able to get a hold of this, China was an example later on, is when they've established isolation units just for people with COVID-19 so that they don't affect or infect anybody else. And so we've seen hospital units that are dedicated to this virus, and also they're building independent units for just COVID-19 people. And these are situations where we've got the actual isolation of the patients. Another phrase that we hear a lot of are these shelter-in-place orders, and these apply to everyone. Healthy people, sick people, they're wanting you to shelter in place, to stay in your home. And that's so that you don't infect other people. Because the incubation period is so long with this particular virus, it can be in your system for up to 14 days. In fact, people can be asymptomatic and not have any sickness or illness at all, but still be carriers of the virus. And so the stay-at-home order is to prohibit contact, reduce contact that you might have with other individuals to prohibit the transfer of the virus. Now, the next thing we're seeing, and we've seen this in 30 states, lots and lots of cities. My city has just done this today, and we've also seen it countywide, and that is to institute a stay-at-home order. However, there are exceptions for essential employees or essential businesses. And the question has come up routinely, even today at my own law office, where people are saying, well, what is an essential business? What is an essential employee? And those definitions vary from state to state, and they vary from county to county. I printed off a copy of an example of one, which defines what we're looking at when we're talking about an essential business. Here is a form ordinance, and I'm just going to read this to you, and it specifically says you're only to leave home under this stay-at-home or shelter-in-place ordinance to visit a doctor or healthcare provider, to go to a grocery store, to pick up food from a restaurant, to go to work at an essential business, and we'll talk about what that is here in a little bit, to go get pet supplies, go to home improvement stores to buy essential items for your home, and you can engage in outdoor activities, including walking, jogging, riding a bike, as long as you maintain social distancing between other people. You're also allowed to travel to care for family members and pets or people at another household that need your help. Prohibited activities include any type of a public or a private gathering. You're not supposed to go into any nursing homes. A lot of places, while parks are open, public playgrounds where people might be touching the same thing, those are prohibited. Elective medical procedures are really not being done right now due to the coronavirus. And in-person seated religious services, because of the amount of people that are involved, are prohibited in most areas at the moment. Now let's talk about when you're allowed to leave your house for essential business purposes. And they have dictated and defined what essential businesses are. And there's four broad categories: healthcare, infrastructure, restaurants, and retail are the four big areas. Now, inside of those, essential businesses in the healthcare area are hospitals, of course, physicians, psychologists, any type of an urgent care facility, pharmacies, labs, those types of things that you would think about when you think about healthcare related facilities. But it also includes veterinary care for your pets, funeral homes, and of course mortuary services and cemeteries. The other category is infrastructure, people involved in infrastructure employment. Obviously, fire department, police department, your EMS operators, 911 operators. And of course, you've got your airports, you've got water, sewer, gas, you're dealing with your utilities. All of those things are essential employees. Solid waste collection, your garbage man is an essential employee. Anything dealing with telecommunications or internet connectivity, banks, any type of residential or commercial construction, and even landscaping in a lot of areas is included. Got to have the grass mowed from time to time. Those are considered essential employees. When we're talking about restaurants, there's no in-dining room seating anymore, but restaurants are considered essential as long as it's takeout service or curbside or delivery service. Nobody's supposed to go inside those restaurants at this point in time. And then also, finally, we're dealing with retails. That's your grocery stores, hardware stores. Liquor stores is included as an essential business. Gas stations, of course, we would need. Convenience stores, laundromats, auto parts stores, excluding sales. Car lots are not to be open. And finally, last but not least, lawyers, accounting, and payroll services are all essential businesses. And people connected with those businesses can travel in connection with that employment, and those businesses can remain open. All other businesses have been ordered to close in at least 30 states at this point in time. Is that it? Should we just shelter in place until everything goes back to normal? Probably. So those are the areas that are included as essential businesses and are allowed to remain open during this shelter in place ordinance. Now, a couple of questions have come up. Is this the last thing the government will do? Or is this the last thing the government can do? Now, it probably is the last thing that the government will do. At some point in time, the virus will peak and it will start going down, and the government will probably start backing off some of these prohibitions. However, there is one further step the government can take, and we don't see this very often here in the United States, but that would be to declare martial law. What martial law is where the military basically comes in and enforces the law. They take over for the traditional occupying power, and in our case and in our country, usually that's the police and the government. When our traditional police force cannot maintain order, there is the power of a chief executive officer to order martial law and have the military come in and basically maintain public order and safety. And that would be a true military state. Right now, under the ordinance, you can get a ticket and be fined and potentially jailed if you violate the order. However, if the military gets involved, it will be a total shutdown, and they have a less sense of humor than some of your local police officers, and you will be taken to, in a lot of cases, military jail if you violate the order at that point in time. However, that is not something we're familiar with here in the United States, and it's not probably going to happen. It did happen if you were paying attention to the news in China, where they declared martial law in areas where there was a total lockdown, where they had a large problem with the virus. But hopefully that's not something that we're going to have to deal with here in the United States. Well, that's all for today's episode. Now, if you have any questions, post them below. We'll do a subsequent episode where we answer some questions related to the coronavirus and these types of ordinances. If you learned something today, do me a favor, hit that like button. And if you want to know more about the law, go ahead and subscribe to the channel. I'd appreciate that, and we can grow this together. Share it if you know somebody that would benefit from it. Otherwise, that's all for this episode. Thank you for watching Lawyer Up.
Send lawyers, guns, and money. Dad, get me out of this.